As an offensive lineman, you push people, and if you're blocking somebody, and I'd just be driving, and then I'd go to plant my left foot, and then my hip would just kind of sink, and I would fall. I would lose my step, and that's when I kind of figured something was wrong.
He came to me this past year at the beginning of the season. He is an offensive lineman. He was a freshman at the time. He was having chronic intermittent symptoms with his left hip, mainly pain as well as mechanical symptoms that we would refer to as popping or catching. And these have progressively gotten worse over the years. He didn't have a specific injury when he was at St. Francis. We found that he had a pretty significant labral tear in his left hip. He and I and his family had talked about that in depth and made a plan, and near the end of the season he decided that it was time to pursue surgical intervention, and I treated him surgically and repaired his labral tissue.
And during the surgery they found out that it was from an acute injury. It wasn't from the spur on my femur. After that, it was kind of just, I basically just sat around for 3-4 weeks, and then I started doing like movements and leg lifts, kind of testing out the joint to see that it recovered. And then after that, it was more progressive. It was band resistance. We did bike work, and then eventually I got up to doing weightlifting, and then it was jogging, and then eventually I had my full range of movement and balance and everything, so I could cut and still play football for that.
He's actually had a very good outcome.